Bismillah ar-Rahman ar-Rahim, my dear students of Ajman University. Today we will talk about the last part of parenterals. If you remember in the second part, we ended talking about insulin, and today we will continue talking about insulin as an injection, as a parenteral preparations, and you need to know that there are many types of insulin, and that's why you should be very aware and very vigilant to which type you dispense to the patient. Now, the first thing we will talk about اللي هو regular insulin. Regular insulins are available as aqueous solutions, and since we are talking about injections, then these are of course sterile. In the old days, many years ago, they were derived from pork and from beef, okay, porcine and bovine. But nowadays, they are almost exclusively derived from recombinant DNA. It's called through biosynthetic mean, and using that technique, we are able to produce exactly the same human insulin that we will give the patients. Okay. Is and nowadays you will not find the pork and beef insulin anymore because we already have the human insulin. طيب, regarding the administration, usually you administer it using subcutaneous route. Okay, this is the usual way to administer insulin, even though you can administer it by other ways such as IV and even intramuscular. But the usual way is subcutaneous, and you do it half an hour to 2 hours before meals. Okay, like half an hour before meal, you take the injection, and then after half an hour, you can start your meal. Now, the usual dose is ranging for most patients, ranging from 5 units to 100 units. And if you remember in our part 2, because now in part 3 parenterals, in part 2 we said that most insulin preparations come with a concentration of 100 units per ml. These are the standard preparations, most of them. Now, it's very important then when you take the vial, okay, you take it from refrigerator, you need to rotate the vial slowly, okay, between the palms of your hands. Okay, it has to be slow and between the palms of your hands several times in order to warm up the insulin preparation and to make sure that the mixture inside is mixed well. Yes, it's a solution, but you need to make sure that it's well mixed. Okay. Now the question is, why don't you shake it? Okay, just hold the vial and go on and shake it. Why do you need to put it between the palm of your hands? One of the reasons اللي هي we want to prevent the formation of froth bubbles, okay, which will affect the measurement of the required volume of insulin. Okay, and another reason, additional reason, is that vigorous shaking can affect insulin molecules and make them less effective. Okay, because you know that insulin is a peptide hormone, it's like a small protein, and it has complex structure, and this complex structure is important for the activity of insulin. Now, to insulin, usually glycerin is added. Glycerin will give stability to the preparation. Okay, it will not, for example, make it crystallize. Okay, it's added at a concentration of 1.4 to 1.8%. This is glycerin for stability. But also as preservative, phenol and cresol can be added. And as you are aware, if we are dealing with multiple injections, okay, multiple container, then we need preservative. And here we have phenol and cresol as preservatives, and they are added in very small quantities ranging from 0.1% to 0.25%. Now, if you are leaving, for example, your vial or your insulin preparation in the car and it's very hot, okay, during summer, you know that, or you want to store it in the freezer rather than refrigerator, then you are doing a mistake, okay, because this will affect the potency and the effectiveness of insulin. It's gonna deteriorate insulin and destroy it. That's why if, for example, you forgot the insulin or the patient forgets the insulin in the car, okay, and it is not stored in the refrigerator, then the vial should be discarded. Okay, you need to buy, or the patient needs to buy a new vial. It's very important that the patient is instructed to rotate the site of injection. Don't inject at the same place. One of the common sites اللي هي around the belly button, okay, that you see here. And if you are injecting on the same place, you might have what we call lipohypertrophy, okay, okay, as you see here, protrusions, or you might get the opposite of that, that is lipodystrophy, okay, indentation, wasting of fatty tissues here, okay, and you see indentation. So these things can happen if you don't rotate the injection site, okay. So what is the solution for lipohypertrophy? Is to rotate the injection site. What you need to know about lipohypertrophy, that there is an increase in the fibrous tissues, and this fibrous tissues, they are avascular, yani they don't have vessels, blood vessels in them, and this will affect, of course, the insulin absorption from the sides, okay. إذا في increase في التissue here, fibrous tissues, which affecting the insulin absorption. On the other hand, lipodystrophy, you will see the wasting of tissues in the area of injection. Yes, one reason is because you are injecting on the same place, but there are other reasons. One of the reasons was attributed to injecting cold preparation, like when you are taking the vial from the refrigerator, you are not waiting enough time for it to ish to come to the room temperature, okay, and you are injecting in when it's cold. Also, another reason that was attributed to causing lipodystrophy is that in the old days, not now, in the old days, the impurities in insulin injections, like the pork and bovine, okay, the pork and bovine and beef insulins, they used to have some impurities, okay. With the advances of technology now, we don't have such impurities, okay. It's very pure insulin that we get, and they found that with the new products coming up that have high purity, this problem of lipodystrophy is eliminated. That's why they say the main reason maybe is the impurities في الانسولين. Okay. طيب, of course, most of insulin injections or preparation, okay, has 100 units per ml, such as the product humulene. شوف, humulene is from human insulin, okay. R for regular, okay. Humulene R insulins usually come in 100 units per ml, but we have some products with higher concentration of 500 units per ml. Now, as I said, human insulin, okay, that are regular insulin. We are talking about regular insulin that was previously derived from pork and or beef. Now it's from human insulin, and it's a regular one. And regular one is a short-acting insulin. Isn't we are talking about regular insulin that is short-acting ish insulin. How is it produced? You have, I'm sure you have taken a biotechnology course, okay? And uh, the way you prepare human insulin is through recombinant DNA technology, and you are using a form of non-pathogenic E. coli. Okay, non-pathogenic E. coli. You are playing with the DNA in order for E. coli to produce this human insulin, and in the end, you are purifying this insulin. You are getting the pure form of human insulin. So you are making changes to the plasmids, to the chromosomes of E. coli, in order to for this microorganism or bacteria to produce insulin. The first insulin product that came from recombinant DNA was the regular insulin, the human insulin, and was available in the market in 1983. We are talking about 40 years ago. Even though it's 40 years ago, we don't consider that a very long time. Still, we have ish, we have more research in insulin production through recombinant DNA. It's very important, and you will see this later, that whenever recombinant DNA is used, then it has to be mentioned in the label that this is rDNA, يعني recombinant DNA technology is being used to produce this insulin. Now, this humulene, the product, طبعا humulene is the product which is produced by Lilly. Lilly produced another product called humulene N. اوكي اذا في عندنا humulene R اللي هو regular insulin ويعتبر short acting insulin that has a duration of action from 6 to 8 hours and consists of zinc insulin crystals. Okay, now in addition to that we have humulene N. Humulene N consists of yes, a human insulin. It's the same insulin that is produced by a human, but we are adding protamine to it. Okay, we are adding protamine. Okay, and protamine is an amino acid. Okay, and it's made in neutral. And the scientist who made this one is called Hegdon. Okay, so Hegdon added protamine to insulin, to zinc insulin, and this allowed it to have longer duration of action. And what you get is referred to as NPH human insulin, or neutral protamine Higdon insulin, or also we call it isophane insulin. The product that is available by Lilly is referred to as humulene N, not a humulene R. R for regular, N for neutral, I believe, and it is an intermediate acting insulin that has duration of action of 16 to 20 hours. So how many injection you need? You need 2 injections of intermediate acting insulin, 2 injections, okay, every day. And that is to mimic basal, if you remember last part 2, okay, last time that we talked about, إنه البasal insulin can be represented by intermediate or long acting insulin. Okay, طيب. Okay, you see here humulene R, this is the regular insulin. You will see here the strength. Okay, it's U100, which means 100 units per ml. This is what it means. And you will see here also in the label that they are saying this is rDNA origin. They have to write that in insulin. This is the humulene N. Okay, and again you see U100, it's 100 units per ml. Okay, and they call it N شو حكينا NPH or isophane insulin. And I want you also to notice that this is suspension. Okay, this is suspension. Whenever you are adding protamine, you'll get suspension. Someone might ask about the pH. The pH is usually around 7 point something. Okay, so it's almost neutral. Another insulin, okay, and it's not the same as human insulin, it has some differences, اللي هو الانسولين ليسبرو. Also Lilly, through the use of non-pathogenic E. coli and using the recombinant DNA technology, they were able to produce insulin Lispro, and the product is referred to as Humalog. Okay. طيب. Uh, of course, again, these are zinc insulin Lispro crystal. Okay, this is not exactly as the human insulin, it's similar. Okay, which is effective, it has similar effectiveness as the human insulin, and it is clear aqueous fluid. What you need to know about Lispro is that it is faster acting than regular insulin, than a human insulin. It's faster. That's why it's given only 15 minutes before meals, and its duration is from 3 to 4 hours. Okay, it reaches the peak after half an hour to 1.5 hours. If you compare it to short acting insulin, the duration is 6 to 8 hours. This is a comparison. Okay, and you need to take it half an hour to 2 hours before the meal. This is just for comparison. Another, طبعا إذا if we want to compare Lispro to regular insulin, Lispro is faster and shorter duration. Okay. طيب another also ultra short acting insulin is insulin aspart. Insulin aspart, and the product name is Novolog, and Novolog is from Novo Nordisk. They also use recombinant DNA, but here they are Novo Nordisk. They like to use اللي هو Saccharomyces cerevisiae, or what they call it baker's yeast in the uh, 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 production of insulin. Okay, so these are the microorganisms they use it to produce the insulin اللي هو insulin aspart. It's ultra short. It's taken 10 to 5 to 10 minutes before meal, and the onset of action happens within a quarter an hour, and the peak comes in half an hour to 1 hour, and the duration of action is 3 hours. يعني it's even faster than Lispro. Okay, but both of them are faster than the regular insulin. Another very fast or rapid acting insulin is referred to as insulin glolisine. Insulin glolisine, and this is from Sanofi. And Sanofi is using the same microorganism as the Lilly اللي هو E. coli, non-pathogenic. طيب, the product called Abidra. Abidra is the product from Sanofi, and it has the insulin glolisine. طيب, it's rapid acting insulin produced by recombinant DNA. شوفوا هون, always telling you recombinant DNA. It's 100 units per ml. It's U100. Okay, and you will notice how big is the letters, so one will not get confused when buying such products, especially that diabetic patients are usually they have some side problems. Okay, so you want to be clear. طيب, the pH, as I said, is approximately it's above 7, it's 7.3. Almost all except one you will see later, where the pH will be ish always from 7.1 to 7.4. So for this one it's 7.3. اوكي this is repeated اللي هو ايزوفين انسولين suspension. اوكي اللي هو يوميلين N by Lilly. If you remember we call it ايش كمان NPH insulin اللي هو neutral protamine hegdon. Well, pH of this preparation is 7.2. Don't forget that we are talking about suspension. Okay. uh, Isophane means equal. Phane appearance. What happens? Why they call it isophane? Whenever we say isophane insulin, it means we are adding equal protamine, equal amounts of protamine and insulin. That's why they call it isophane. Okay. This is an intermediate acting preparation as we discussed before. See the pH from 7.1 to 7.4. Okay, this is a humulene N, again you 100 units per ml. Now you know that, and we discussed this in last part. We said that we need basal insulin, يعني a secretion of insulin continuously at low rate, okay, and a surge of insulin ايش when we take food. Okay. That's why you will find a mixture of basal and regular or short, very short acting insulin, such as, for example, in this case, from Lilly, from the company Lilly, you have isophane insulin suspension mixed, ready mixed, pre-mixed بنحكي لها pre-mixed with regular insulin 70 to 30. Always the largest will be for the basal insulin. Basal insulin, again, it's either the intermediate or the long acting insulin. Okay. طيب, this preparation or this mixture is available as 70-30 or it might be equal اللي هو 50-50. Okay, so the physician will tell you which one to take, okay, according to your condition. Okay, you see here 70 humulene 70-30. 70 اللي هي الانترميديate وال 30 اللي هو regular. See here, this is a pen. Okay, and here we have 50-50. الانترميديate 50 و short acting or regular 50%. يعني 50 units from per ml from the regular or from the intermediate, and 50 units from the regular. Another mix also from Lilly اللي هو which makes Lisbro, وعندهم البرودكت اللي هو Humalog. They have Humalog mix and they have it as 75-25 and 50-50. طبعا again 75 is the intermediate. Okay, now I want you to pay attention here. Now what is the intermediate they are using here? They are using the NPL, neutral protamine Lisbro. NPL, not NPH. Okay, because the insulin they are using is not the human insulin, it's the insulin Lisbro. And again, similar to human insulin, they added protamine to get the NPL Lisbro, which has an intermediate duration of action. Okay, so insulin Lisbro is 25 and NPL is 75, or we take it as 50-50. And according to statistics, they found that more than 40% of diabetic patients who inject insulin twice daily, يعني twice with the mixture, they are using ايش? A Humalog mix, which tells you that it's very popular. And then this one is popular, a Humalog mix. طيب, from Sanofi, okay, Sanofi, which uses E. coli like Lilly, okay, they produce insulin glargine. Is an insulin glargine, and the product name is Lantus. Now, they use it also by recombinant DNA. So, for all insulins nowadays are produced by recombinant DNA. And let me just clarify something. Not all of them are human insulin. Okay? Not all of them are human insulin. They can change the sequence of amino acids في الانسولين in order for example to get a different characteristics of insulin, such as longer duration of action or shorter duration of action. Okay. طيب, insulin glargine produces insulin that is long acting up to 24 hours, يعني once daily, right? Basal insulin, okay, intended for once daily subcutaneous administration when it's before bedtime, okay, or at bedtime. The strain that they use is E. coli K12 host strain. That's what they call it. See here, they must mention its rDNA origin. They said injection, معناته it's sterile, 100 units per ml U100. The product name is Lantus, and it's available as pen. شوفوا, this is the only preparation with a pH of 4. Okay, so it's acidic. Okay, but when it's injected into subcutaneous tissue, what happens to the pH? It gets neutralized by the surrounding fluids. When it neutralizes, what happens to the insulin? They form microspheres, and these will allow longer duration of action for insulin. طبعا, of course, this is pH 4, it's the only one, so we should not mix it with any other insulin that can change the pH. Another product from Novo Nordisk, which uses which microorganism? Saccharomyces cerevisiae, اللي هو البيكرز yeast. Okay, now this product is referred to as insulin detimir, and the product's name is Levimir. Okay, now this product is intermediate to long acting insulin, and the duration of action can range from 8 to 24. That is depending on the dose. The higher the dose, the longer is the duration of action. It can be given once or twice daily, طبعا depending on the dose. The pH is 7.4 and the solution is clear. This is the Levimir or Detimir. You will see that here recombinant DNA origin, and it gives you the concentration. And this is the pen, and in the pen you will see the how the dose adjustment happens. Okay. Okay, the last product that we want to talk about is referred to as insulin diglodec. Insulin diglodec, and that is from Novo Nordisk, and the product's name is Tresiba. Tresiba. Okay, this product is given 3 times a week because it has an action or duration of action extending to more than 40 hours. Okay, of course, this is ultra long, معناته ultra long acting basal insulin. Okay, this is the pen, and in this graph you see comparison between the how the effect of different types of insulin. For example, you will see that Lispro, Aspart, and Glulizine, they act very fast, and also the duration is small. For regular insulin, it's longer. For the intermediate, اللي هو NPH, neutral protamine hecdorn, it's the intermediate. and for the longer ones اللي هو الانسولين ديتمير وجلارجين. Okay, diglodeg is not in this graph. This table summarizes all that we discussed. Okay, so it's important that you look at it because it's the summary of everything that we discussed. طيب, we finished now the small volume parenterals. We said it's up to 100 ml. It can be single dose or multiple dose. Now we will talk about large volume parenterals that can only be single dose. If you remember in part 2 we said that multiple dose containers will not contain more than 30 ml or 10 doses, and we said why. Okay, يعني containers having more than 100 ml of course will not contain a bacteriostatic or a preservative material, because we don't want accidentally to infuse large volume or large quantity of preservative that can cause toxicity or cancer, okay, or other problems. في large volume parenterals that are administered again as single dose, it's very important to pay attention to the possibility of forming insoluble precipitate when you are mixing things together. يعني I want you to imagine the infusion bag, the bag that will contain the liquid, and this liquid maybe normal saline containing other drugs, or maybe nutrition, okay? And there is, because we like to utilize the infusion bag to put more drugs and to put more materials. Usually we like to do that. That's why there is this possibility of precipitate forming. And what will happen if there is precipitate and it's infused in the veins? It may block some of the veins, and you might end up in, or the patient might be, or might suffer from severe problems because of that. طيب, what are the factors affecting whether a precipitate will form or not? First, number one, اللي هو concentration of individual ions. Okay, of course, the higher the concentration, the possibility of precipitation can increase. The salt form, some salts are soluble and some salts are not. One of the most famous precipitate is the calcium phosphate. This is very famous precipitate in IV infusion. So you have to be careful with regard to how much calcium and phosphate is there. Another thing that can affect precipitation is the concentration and type of amino acids you use. Also the concentration of dextrose. طبعا dextrose is the same as glucose. Okay, the temperature. Maybe something is soluble, and when you put it in the refrigerator it might precipitate. The pH of the total parenteral nutrition. Okay, the presence of additives. For example, some cases we are adding copper as trace elements, and when there is this amino acid cysteine, a precipitate of copper cystinate might form. Even the order of mixing is important. You should not, for example, start with the material that is highly soluble and you end up with the material of lowest solubility. No, start with the material of lowest solubility. So the order of mixing is important. Because of the danger of precipitation, you need resources, okay? And one of the resources is the Handbook of Injectable Drugs, is referred to as TRISLs. Another resource اللي هو King's Guide to Parenteral Admixture, okay? And you can also have or from your own experience in the hospital, you might develop uh, uh, um, a procedure, okay, that okay, I noticed that when this was mixed, a precipitation happened, it should not be done. So from your own experience and from the literature, يعني especially primary literature, and we have readily accessible databases such as lexicom, which you will learn about how to use it in the drug information tutorial. You will learn about how to use drug information databases in order to get information regarding parenteral admixtures. Okay, so we have lexicom, we have micromedics. Lexicom is nowadays more famous, and our university is subscribed to lexicom, and you can use it to obtain information about incompatibilities and compatibilities in parenteral preparations. طيب, also you need to pay attention that the infusion set itself might adsorb and absorb some of the drugs that you might add, or some of the elements that you might add to the infusion bag. This is not a problem unless the amount you are adding is small. Suppose I'm adding small quantity of drug and then some of this drug get absorbed, then this is a problem. Some of the abbreviation that you need to be familiar with اللي هو CVTPN اللي هو Central Vein Total Parenteral Nutrition, TPN اللي هو Total Parenteral Nutrition, PPN اللي هو Peripheral Parenteral Nutrition. There are other abbreviation you need to memorize, like unspecified, bacteriostatic water for injection, sterile water for injection, dextrose 5% in water, dextrose 10% in water, 20%. 20% is considered as high concentration. Type dextrose 5% in LR. You remember LR, lactated ringer solution, and so on. Okay, you need to memorize all these abbreviations. طيب, parenteral nutritions are employed for maintenance therapy or replacement therapy. Replacement therapy is more severe, which means that your body is lacking something and you are trying to replace what is lost or what is not there. Okay, maintenance is just you are giving the daily requirement of electrolytes, carbohydrates, etc. Okay, see here the TPN, total parenteral nutrition. It's given through central vein. Why? Later we will talk about it. Or we might give the parenteral nutrition by peripheral vein if it has low concentration of ingredients. Okay, so for maintenance therapy, water, dextrose, and some amounts of sodium and potassium will usually be sufficient, okay, when it's the duration is not long. But when the duration is long, maybe for weeks or longer, and you need to fully support the patient because he's not able to take anything by mouth or orally, then you will need what we call TNA, or total nutrient admixture. Okay, and they are also referred to as 3-in-1 preparation because they contain the main ish the main materials, carbohydrates, protein, and fat. Of course, in addition, they will contain electrolytes, trace elements, okay, and they are mixed in a single plastic IV bag. Okay, that's when you really need to support the whole body. Now, for total nutrient admixture, you will need to filter it, okay, before infusing it through 1.2 micrometer filter, because you don't want, for example, a precipitate is there and you cannot see it, okay, So you are filtering it through 1.2 micrometer filter in order to allow the lipid particles to pass, but something larger should not pass. Lipid particles or globules can have a size from zero point 0.1 to 1 micrometer. If there is no lipid, okay, it's not emulsion, there is no lipid, then you will need to use 0.22 micrometer filter that will preclude or will prevent or will retain not only bacteria but also it's for air elimination. Okay, so use this filter when the preparation is lipid free, okay, like in 2-in-1 preparation. These are the inline filters that are used. Okay, you see this one for preparation containing lipids, and this one when there is no lipids. Replacement therapy, again, it's used when we want large or unusual amounts of water and electrolytes, and the condition is طبعا when the body lost a lot of electrolytes, okay, a lot of energy, a lot of fats, a lot of carbohydrates. When the body lost a large amount of that, you need replacement. Plus, you need then to maintain, okay, whatever is there daily, okay. And this can happen when there is severe diarrhea or vomiting, when there is the Crohn disease, اللي هو like irritable bowel syndrome, when there is AIDS, when there is burns, trauma, then you will need replacement therapy. The daily requirement for water in adults ranges from 25 to 40 ml per kilogram or 2 liter per square meter body surface area. Of course, in children and small adults, the amount of water needed will be more because the body composition, okay, in children, okay, has larger percentage of water compared to adults. For electrolytes, you need to know that potassium is very important because it's the primary intracellular cation. It's the primary one. It can influence the normal cardiac and skeletal muscle functions. With hypokalemia, يعني little potassium, you will see weak pulse, faint heart sounds, falling blood pressure, general weakness. Okay? Severe loss of potassium can lead to death. Hyperkalemia, the opposite, you might have, or the patient might have diarrhea, irritability, muscle cramp, pain. Okay. In any replacement therapy, it should include the maintenance dose of a minimum of 40 milliequivalent of potassium per daily or per day, once per day. Okay. And the infusion of potassium should be in a rate between 10 milliequivalent per hour to 40 milliequivalent per hour. It's very important that the patient is monitored through ECG because potassium can affect the electrocardiograms, ECG of the patient, and higher or faster or rapid infusion of potassium can cause cardiac arrest, which can cause death. طيب, potassium is the primary intracellular cation. Sodium is the principal extracellular cation. For example, it will be in the blood, okay, which are extracellular in the blood vessels, and it's vital, it's important to maintain the extracellular fluid. That's why the pressure, blood pressure, is influenced by sodium. With little sodium or excessive sodium loss, يعني little sodium in the body, you might have fatigue, if muscle weakness, convulsions, etc. And with excessive sodium, يعني too much sodium, opposite, you will have dry or sticky mucous membrane, flushed skin, elevated body temperature, lack of tears, etc. What you require daily okay, uh, is 3 to 5 grams of sodium chloride when you have loss or deficiency. Okay, you need 3 to 5 grams of sodium chloride, which is equivalent to, if you convert this, okay, it's equivalent to 51 to 85 milli equivalent of sodium. Remember, when I say 51 to 85 milli equivalent of sodium, it is the same for chloride and it's the same for both. Chloride, the anion, is the principal anion extracellular, so it's with sodium. Okay, that's why usually it's paired with sodium, it's extracellular. Again, it's important to maintain fluids and acid base balance of the extracellular fluid. For parenteral nutrition, again, let's go back. I told you when the concentration is high, for example, when dextrose concentration is 20%, this is considered high. It means we are trying to give a lot of energy to the patient. It seems he's weak, he lost a lot of energy, a lot of carbohydrates. In this case, we give high concentration of dextrose, we give electrolytes, vitamins, and in some cases insulin. Okay, see, we are giving a lot of glucose. We might need to give insulin to control hyperglycemia and to allow glucose to get into the tissues. Now, if it is high concentration, then we have to administer the preparation with high concentration. We have to administer it through a large vein. We cannot administer it in a small vein. And large vein is superior vena cava. Superior vena cava, now we will see we can access it through subclavian vein. See here, this is the shoulder, okay, and this is the subclavian vein, and this is the supervena cava. Okay, so this is the heart here. So see, we are going into a large vein, like here, like what you see here. Okay, we are going to large vein. Why can't we do that in small vein? We will have trouble. See, when you do it in large vein, then there will be a lot of blood and it will mix quickly with the 20% dextrose and other materials. And these materials have high concentration. Remember tonicity. They are hypertonic. These materials are hypertonic. That's why we want the preparation to quickly get diluted when it goes to the blood. That's why we need large vein. If we do it peripherally, in a peripheral vein, then we will have problems of hypertonicity. Okay? Now you need to be familiar with programmable devices that can compound simultaneously the nutritional admixtures as you see it here. This is what you see here is a 4-station called Nitromix Macro TPN compounder, and it is by the company Hospira. Do you remember this company, which is famous in parenteral devices? Now this company is for Pfizer. Pfizer is the largest pharmaceutical company. Okay, and you put the different, as you see here, different bags. You have here lipids and maybe fats, maybe carbohydrates, proteins, electrolytes, and all of them they get compounded in this total nutritional admixture bag. Okay. طيب. Later on, you need to infuse these products into the veins, right? And instead of relying on gravity for the flow and infusion of the preparation, you need to use infusion pumps. Infusion pumps are cost efficient devices that provide greater accuracy and reliability compared to relying on gravity for the flow. One of their characteristics is that these devices can allow piggyback secondary medication. Okay, usually the piggyback secondary medication has a volume ranging from 50 to 250 ml. This is the piggyback secondary medication. You will see here the piggyback. You see here the main bag. Okay, this is the main one, and this is the piggyback. So the piggyback is relying on the main set, the main infusion. You will see that it is higher up compared to the main infusion bag. It's higher up, and the infusion pump here will allow the piggyback first to go, and then it will continue with the main infusion bag. Okay, طيب. So piggyback relies on the main infusion bag because it uses the same line. The infusion device will allow the piggyback to be administered, and then it will continue with the main set. Now piggyback, as I said, it's from 200 from 50 ml to 250 ml, and it's usually intermittent. It's not the continuous one like the main infusion bag. Okay, it's intermittent. يعني it's given in half an hour, for example, and then you continue. Maybe next day or after 12 hours you do it again. Okay, with another piggyback. طيب, these pumps are classified according one to mechanism of operation, how it operates. One mechanism is peristaltic. What you see here is peristaltic. You see these are the tube. Okay, and here you see something that is pressing. It presses on the tube and rotates. When it press on the tube that has liquid and it rotates, it will allow the liquid to pass and to rotate from one side and continue to the other end. Okay, there is also is an according to mechanism of operation. It can be classified as peristaltic or piston. Piston is just like similar to the injection and the plunger. Okay, the one that you push and withdraw the medication with. And there is the diaphragm. إذن this is B. في عنا C اللي هو diaphragm. Another way of classification is according to the frequency or type of delivery. Is it continuous or intermittent? Continuous يعني continuously administering, or it's intermittent يعني it gives and then stops for some time and then it gives again, intermittent. Bolus dosing, single dosing, or multiple solution. Can it take multiple solution or just single solution? Does it give one injection يعني for example in 1 minute you inject? Okay, these are the classification. Or the other way is according to therapeutic application. If you remember the PCA, patient controlled analgesic, okay, or analgesia, then this is according to the application, to what I'm applying the pump. These are the classification. Okay, now it's important to know about how, if you are working in a hospital, how to handle and dispose chemotherapeutic agents. And when we say chemotherapeutic agents, we normally mean agents for cancer. And these agents are very dangerous. And because of the risk they pose to everyone working around the area. Because one of the adverse effects of these chemotherapeutic agents with anyone working with them اللي هو skin rashes, and this is the lowest risk. Okay, but the effect might be severe to affect the reproductive system, and even it can cause cancer to the person who's working with these agents if this person is not taking precautions and the necessary training. They may cause mutagenic and allergic reaction in the person and in the fetus, la سمح الله, if someone is pregnant. According to ASHP, اللي هو American Society of Health System Pharmacists, it is recommended that personal protective equipment is used, and biological safety cabinets. Okay, these cabinets do not allow anything to escape from the cabinet to go into, for example, the person who's working in the cabinet. Isolator. Isolator معناته the whole cabinet is isolated. Okay, you have gloves from outside going inside, and that's what you use, so there is complete isolation. You need to reduce exposure during the administration. You need to have spill kits. What happens if something is spilled? You need to treat the workers if something happens or they come into direct contact with hazardous material. The enforceable one is the United States Pharmacopoeia 797, and their recommendation for compounded sterile preparation, CSPS, okay, is that you should use class 5 environment. And ISO class 5 environment means شوفي class 5 and 10 to the power of 5. There should not be more than 10 to the power of 5 particles that has the size of zero point 0.1 micrometer in 1 cubic meter. Okay? And negative pressure should be used, which means that in that room or in that cabinet, the nothing will come out from that cabinet. It will only suck things inside. Okay, so it will not contaminate outer environment. Again, biological safety cabinets will be used, or isolators such as compounding aseptic containment isolator, CACI. Also, it's very important to use closed system transfer devices, CSTDS, because you don't want to come in direct contact with the hazard material. You use what we say closed system transfer. So everything, all the transfer you are doing is in closed system environment. So nothing is vented, okay, to the environment. It's very important to carry on training of personnel. This is very, very important, because without training and without education, the person who's working will not be able to know why he's doing this and why he's not doing that. It's very important to have proper hygiene practice. Okay, always wash hands, use uniform, train yourself in aseptic technique, how to disinfect compounding surfaces, also how to avoid direct touch, because they found that direct touch is the most likely source of contamination in compounded sterile preparations. Use sterile gloves, use disinfectants such as 70% isopropyl alcohol. The last thing we want to talk about in this part is regarding irrigation and dialysis solutions. We talked about this and we said that they must be labeled not for use for IV infusion. These are not injected into vein. These are out of circulatory system, and they don't go to the blood. They are not supposed to go into the blood. Dialysis solution are usually infusion bags like what you see here. Okay, these are for dialysis. Okay, but for irrigation Usually they are either infusion bag or top screw capped bottles like this, or they may be like this if they are for irrigation. Irrigation means washing, for washing wounds, for bathing organs, for surgical washing, surgical incision, body tissues, washing them. Okay, but for dialysis, dialysis is different. Okay, dialysis is for cleaning the blood, okay, from waste materials. Those who have kidney problems or they are not able to clear toxic materials from their blood, okay, they use dialysis. And dialysis, we have two types. One is hemodialysis and the other one is peritoneal dialysis. So what is dialysis exactly? It's we are utilizing a membrane separating the dialysis fluid from the blood. We are utilizing this membrane, okay, to allow toxic material to come from the blood, okay, and into the dialysis fluid. Now, some of the material from dialysis fluid, okay, some of the material might go into ish, into the blood, okay, but there is separation between them. يعني dialysis fluids do not go directly into the blood circulation. What's their job or what are they for? They are to clean the blood from toxic material, okay, taking advantage of diffusibility through the membrane that separates dialysis fluid from the blood. طبعا we use large volume of dialysis fluid, okay, very large volume, in order to do thorough cleaning of the blood. But of course, this can affect, like if the patient is taking a drug, medication for heart or for something else, dialysis can affect the elimination of the drug, or it can remove that drug also from the circulatory system. What you see here is hemodialysis. So from the artery, it goes to the dialyzer, feel membrane, okay, where separation happens and toxic material goes into the dialysis fluid, okay, that goes and comes from these sides, okay, and then the blood goes back into the vein. Or hemodialysis in the belly, okay, taking advantage of peritoneal membrane, okay, that has blood vessels. So the peritoneal membrane itself is acting here as the filtration membrane, okay. I hope this was interesting to you. By now we have finished now the third part of parenterals. Of course, if you have any question, you can always come and ask me. Thank you very much for your time.